Well, welcome to Focus Today. I'm your host, Perry Atkinson, and delighted to have back in the studio with us today Dr. Thaddeus Gala. Why can't you be Ted Smith? Anyway, he's great. And he heads up Complete Care Health Centers in Southern Oregon. He's the author of a fascinating read called The Secret to Defy Disease and Decay. We're here to talk to him today about something I think we're all concerned about, vitamin D. And big topic and a little pill, right?
Yeah, I love the intro. Something we're all excited to talk about. I don't know if very many people that are excited to talk about vitamins, but we can try to.
Well, I'll tell you why, because it always comes up, and it always comes up in the wintertime, whether or not they should be taking these supplements, and continue to take it through the summertime when everybody's outside soaking up vitamin D. But it comes in a variety of things. Let me ask you this quickly. We had this little discussion before you came on the air. The difference between vitamin D and D3.
Sure. So one is more, well, it's just the form of how your body uses it. So when you look at vitamin D natural production, and something you said just sparked that was from the sun. Yeah. There's research that shows, well, first to answer that, the research that shows that when you do either vitamin D2 or vitamin D3, in terms of blood levels, you'll get about the same results. And that's been done either vitamin D versus D3 versus vitamin D2, or they've done it half and half, that ultimately in the blood levels, it'll show up to be about the same. Okay. So from that, I'd say I think a lot of the controversy from that has kind of been put to rest. But in terms of vitamin D, and we talk about getting it from the sun, natural sources versus diet, we know that the sun is far superior, and we also know that when the sun hits your skin, it forms vitamin D, or precursors, but it also forms about 9 other things that we don't fully understand what they do yet. Oh. So if you take a vitamin D pill, you're getting just one form of vitamin D, versus when you get it from the sun, you get the vitamin D, but you also get about 7 to 9 other chemicals that are made that we're still researching that we think are probably important for something. We just haven't identified yet.
So what are the benefits of vitamin D? Why do we need it?
I would say probably the easiest way to distill down why we need vitamin D is that if people, do you have kids, Perry?
Yeah, they're older now.
Okay.
Yeah.
So imagine how frustrated you'd be if your kids sat down at the dinner table and started smoking cigarettes.
Well, they wouldn't live to their next birthday.
So if we,
no, just kidding.
Well, I've heard physicians say, and I would agree with this, if we really understood the importance of vitamin D, it would be, I think it's borderline recklessly irresponsible for physicians not to be monitoring this and have the same sense of urgency of people monitoring their vitamin D with the same passion as we would tell people to not smoke.
Really?
When you look at people not getting their vitamin D in the appropriate levels or getting this hormone in the appropriate levels, that can translate to having the same health consequences as though you're smoking a pack of cigarettes every day.
No kidding. My stars.
So there's myself and other researchers would say that this is considered one of, if not the top health issue in the world, because it translates to so many other health issues. Really? It's been linked to 25% all-cause mortality. It's been linked to, just by maximizing your vitamin D levels in the appropriate range. Now, to be clear, you have, when you look at a lab level of your blood levels, you have let's say which way is low and high here. Yeah. So let's say this is low. Yeah. So if this is low, meaning this is normal and this is deficient, and then this is high and this says excess, well, a lot of physicians say, well, if you're right here, you're okay. But we know this is the range, so where's optimal in there? Right. So if you get it optimal, which we can talk about that, you can reduce your risk over a 4-year period of all cancers combined by up to 77% if you're also taking it with a supplemental calcium.
All right, so that's where I was going to go next. So supplemented calcium, so D and calcium. Can you OD on D?
That's a great question, and it's a common one, and I think that's probably one of the biggest misconceptions. You can, but it is extremely rare. I would say the average physician probably has never seen it and never would see it. Going back to one of the earlier comments, I would say that if physicians, people, and the layperson alike all recognize the power of this hormone and this chemical, we would look at it from the same stress level as trying to convince someone to not smoke, as making sure that we get the appropriate levels versus having fear of getting excess or toxicity. We know that you need to be taking exorbitant amounts of vitamin D for extended periods of time to get anywhere close to exhibiting toxicity levels.
Okay, so this is big. So a lot of people just get into the bare minimum and say that's okay. You're saying no, you got to bump that up, get up towards the optimum. Well, so are you saying sunshine and a supplement?
Yes. Yes, absolutely. And here's the thing, if you look at all the nutrients that we have out there, vitamins, minerals, antioxidants, bioflavonoids, all these chemicals that we know are healthy, and you look at the even just the government, we don't need to get in a political conversation, but I think sometimes the government is possibly a little bit behind on the times. And when we look at that is vitamin D is one of the few, if only, vitamins or hormones I hesitate saying vitamins and hormones because it's more of a hormone than a vitamin, but they classify it as a vitamin, that in the last few years, they've tripled the recommended dose. So if the government is recommending 3 times as much now as it was even just a few years ago, we realize now that the research is starting to get out there about the importance. Now, the governmental recommendations are far, far drastically below where you need to be. So yes, I think you need to be supplementing and getting sunshine.
So am I hearing you say that D is a main ingredient to a healthy immune system?
Oh yeah. Yeah, it's been shown to, so if you look at the latitude, right, across the US, and you just go up, basically the farther away you get from the equator, you get higher rates of MS, autoimmune issues, you get a 50% higher risk of cardiovascular disease. So all of these rates go up the farther you get away from the equator. And we know that about, I'd say just for rough across the US, if you go from about Atlanta to, let's just say San Diego roughly, it's impossible to make vitamin D for about 5 months out of the year from the sun. So that's why we find that the higher you get away, higher latitude, the higher rates of autoimmune issues.
All right, so some of the risk of too much sun exposure is the other downside of that.
So let's talk about that, the sun risks, right? We know that actually, when you look at the more aggressive type cancers, we know that those show up in areas that aren't typically exposed to sun. And there's research that came out in the last couple of years that shows that skin cancer, or melanomas for instance, are actually lower in people that have occupational exposure. So meaning if let's say you worked out, let's say you were construction or you worked outside or you're regularly getting sunshine, you actually have lower rates of certain skin cancers than those people that are kind of the weekend warriors, right? And go out and they maybe get a burn. So typically what we suggest is sunblock and protecting the face, and then getting arms, legs, and chest for about 20 to 30 minutes between the hours of 10 to 3, as long as it's not wintertime. Because in the wintertime, it doesn't matter, you won't make vitamin D unless you're vacationing in Hawaii or somewhere more south.
All right, so you test for this as to what your levels are, and as a physician, what are you looking at?
So when we look at the vitamin D levels, what we want to make sure, so I'm a little bit different on this. If you look at more of the progressive physicians, they'll say vitamin D levels of at least about a 60. I'm of a different camp, I say about 80. Now that's not off a lot because when you think about the range, it's typically about 25, depending on which lab you're looking at, it's about 25 to 30 or below, they say is deficient. So I think as long as if you're 60 to 80, you'll be covering a lot of the main, the best optimal range.
All right, one other quick question before we take a break. And that is age a factor here on the patient? Older people should have more or less? Or?
Great question. So age can be a factor. We find that people that are overweight or obese need anywhere from 2 to 3 times as much because it's a fat soluble that can affect it. Plus, we also know that vitamin D is regulated by your liver and your kidneys. So if you have a liver health issue or if you have kidney issues, that can disrupt your vitamin D levels. So getting from the sun is always going to be the best, but also taken orally. Personally, I take vitamin D year round, and I also try to get sunlight when I can, and then I cover it mechanically or with a really healthy sunblock. But yes, age can be determined, so that's why you need a test at the end of summer and again at the end of winter. That way you can get your maximum minimums and you can adjust throughout the year.
All right, we're talking to Dr. Gala with us today. By the way, he heads up the Complete Care health centers here in Southern Oregon, which is also where we have our good friend Dr. Joel Klein with us. There's his book called Cookbook to Defy Disease and Decay. Hey, I see some nice things there. And then The Secret to Defy Disease and Decay, check it out. And his website is completecare.net. We'll take a quick break. We'll be right back. Welcome back, and what a delight to have back in the studio with us today Dr. Thaddeus Gala. He is the founder of the Complete Care Health Centers in Southern Oregon, the author of a great book called The Secret to Defy Disease and Decay. There's a picture of it on the screen there, along with a cookbook. And how did they get a copy of that?
People can go to our website, or
Okay.
they can, I think it might even be on Amazon, or they can go on our website. And the book was made intentionally very small, very thin, so people actually read it. It's condensed.
There you go. All right, it's called CompleteCare.net is the website, CompleteCare.net. And all right, we're talking about vitamin D. An interesting topic. You made the statement earlier that a lack of vitamin D could be equivalent to smoking a pack of cigarettes a day. That's a huge statement.
It is.
And so the awareness of vitamin D is coming up. Of course, we always think of it as sunshine.
Right.
You get it in the sunshine. We're watching animals lay out there and they get their vitamin D stretched out on the grass there. And we can also get too much sun, could be damaging.
Right.
So you're saying a combination of natural sunlight, especially at this time of the year, and then as we move into the fall and the winter, we should be taking supplements, and you're suggesting D3. But the levels, that's the key.
Yeah, absolutely.
The levels.
And that's the thing is, Perry, once you get this, once the individual gets their game plan mapped out, you can kind of set it and forget it, which is kind of nice. So it's probably one of the easiest, most affordable, most impactful single thing you can do for your health is getting this set up for yourself.
Okay.
And what I mean by that is, excuse me, at the end of summer, test your vitamin D levels, because that'll give you your high, right? Then you know where your maximum is kind of coming out of summer.
Okay.
And then, so about September, October, test it, and then again, test it again coming out of winter. So about March, April-ish. That way you get your high and your low, and then you can determine how much you need to be supplementing year round. And then after that, you could probably test it once a year just to maybe up or go up or down. But once you get this done, you're set for the rest of your life. And I think I was reading a report saying over 70% of people in the U.S. are deficient in this. That's huge. It's huge.
Are you saying it's also a contributor to cancer?
Oh yeah, absolutely. So breast cancer, right? Huge issue, right? Big topic in the U.S., serious stuff. There's some reports to suggest that just by optimizing, now not taking vitamin D, but optimizing your vitamin D levels, because some people just take vitamin D, because a lot of people say, oh yeah, but I already take it. And then my follow-up question is, okay, that's great, wonderful. What's your blood level? And then that's when we get the deer in the headlight look, right?
Yeah.
So what I say is, yeah, it's great to take it, but you want to be optimal. And if there's research to suggest that with breast cancer, if you optimize this level in your body, you can reduce your risk of all breast cancer by up to 83%.
That's a huge number.
So to me, it's like we were saying when we were off the air there, it's little hinges move big doors. Why wouldn't you want to know where this is at all times?
All right, let me say to our viewers and listeners, we're going to open up the phone lines, give you a chance to talk to Dr. Gala. The phone number to the studio here is 541-776-5770. We don't do this very often, so here you don't have to stand in line and pay for it. Now give us a call, 541-776-5770, if you have any questions for him while he's with us. All right, so often we take a handful of vitamins.
Right.
I do that. And I have this cocktail in my hand at 4:30 in the morning.
So I'll just give you the gold. You get the gold star for the day just because you're taking it and you're trying. So you're already doing great.
I'm downing it with no food, which I've had a lot of people say that's good and it's bad, but it's just my lifestyle. I get up early, I take my pills, and I head to the office here early in the morning. So does D get lost in a cocktail like that?
Yeah, great question. So vitamin D is a fat-soluble hormone. So if you're ideally you want to be taking it with a little bit of food with a little bit of fat in there, so it can help get emulsified. The other thing, so for me, typically what I suggest is, I think it's great, like you're saying, find your routine, right, and get that going. And what I typically suggest for me, because I don't eat breakfast. I eat lunch and dinner, and I usually eat big meals on those, especially dinner. Is take a bite or two of your food, take all of your supplements, and then eat the rest of your meal.
Okay.
Because when you take vitamins and minerals, it's in a very concentrated form that you wouldn't necessarily find in nature. So when it goes into your body's digestive juices, if you will, they aren't used to that concentration of vitamins and minerals without other stuff with it to digest. So sometimes some people, that can even give them a stomach ache. They can be a little bit nauseous. I've even seen people throw up by taking vitamins and minerals on an empty stomach. So I typically suggest taking it with food unless you're taking something that would warrant taking on an empty stomach, such as there's some supplements that are more geared towards being like proteolytic enzymes, or that are more anti-inflammatory. Those things you actually do want to take on an empty stomach. But for what I call the core 4, fish oil, or like EPA, DHA, fish oil, multivitamin, magnesium, and vitamin D, taking those with food is usually better.
All right, let me take some phone calls here. Hi, Lisa. Thanks for waiting. What's your question to Dr. Gala?
What kind of calcium does he want us to take with the vitamin D?
Oh, great question. So let's talk about that a couple different ways, because there's a lot of different types of calcium out there. Number one is you want to be taking, well, it depends on your age, but for the average adult, you want to be taking anywhere from about 800 to about 1,200 milligrams of calcium. And when you take your calcium, you want to be ideally taking it also with your vitamin D. You also want to be taking it with your magnesium, which is about, I'd say for magnesium, you want about the same. You could do upwards of about 800 to 1,000. For magnesium, depending on the type that you get, you may have some loose valves with it, so you might need to slow kind of increase your magnesium intake. And then vitamin K. So before I give my recommendation, I would also kind of put the asterisk that you need to be taking it in conjunction, because it's a synergistic type mineral. The other thing that I would say is how do you know if you have a good calcium? Because there's a lot of different calciums out there.
Right.
So there's a report that was done that says if you actually take your calcium supplement and you put it in vinegar and you let it sit for about 20 minutes and stir a little bit, if it dissolves, then that's probably a good one to be taking. Oh. Because I actually had a patient, she worked at a waste management plant, and she said they would find mounds of vitamins that would end up on the tail end of the sewer system, on her end, that they would find that they'd have to clean up out of the sewer system. They'd find mounds of undigested vitamins.
Wow, there you go.
So finding one that's good to digest, and a great way to test is put it in some vinegar, stir it up, let it sit for about 20 minutes, and then and that can be a great way to see if it's digesting.
All right, thanks, Lisa. Let's go to Ginger. Ginger, you have a question about leg cramps? Turn your radio down.
I turned it off.
Okay, there you go.
I get leg cramps, especially if I'm losing a little weight. If I don't eat a lot of carbs, then I start losing a little weight, and I get terrible leg cramps in the night.
So, can I clarify? Is it more restless leg syndrome, or leg cramps, or Charlie horses, or are the muscles actually binding up?
In my muscles, in my feet, like I have to hop up out of bed and exercise
and try to stretch it out.
Yes.
Okay. So a couple things. Number one is, I know we're on the air here. I'm not establishing a doctor-patient relationship. Right. So I need to say you do need to talk to your doctor about that, of course. With that in mind, so I can speak more generally. So of course, anything that I say here, you need to run by your doctor, and that's the disclaimer.
Right.
So with leg cramps, a couple things that can be going on, and it may not be necessarily a vitamin D or mineral deficiency, but typically that's where I would start, is making sure that you're taking what we term the core 4. So making sure that you're getting a baseline of vitamins and minerals, and that your micronutrients are being brought up to speed. That's number one. Making sure that you're getting appropriate water, and then also you need to evaluate and make sure that you're not doing other things in your life that are causing inflammation in your body. And that's a big thing that I lecture on, is inflammation. Because typically if people's chemical body, or they're out of balance chemically, then that can show up as things like leg cramps, headaches, spasms, Charlie horses, things like that.
Okay. All right. Thanks, Ginger. Let me ask you this before we take another break. By the way, a phone number if you want to ask Dr. Gala any questions. The phone number is 541-776-5770. That's the number to the studio here, 541-776-5770. Sometimes you'll see calcium, magnesium mixed. Are those blends, or do you want them separately?
You can do that. It just depends on if it's dissolvable or not. So I think kind of even doing that vinegar test, again, it's a real cursory kind of cheat way to see if it's a good one. But yeah, you can do a blend. That's why for me, like even with vitamin D, I like vitamin D with a little bit of vitamin K in it, as well as taking it with what we call like a Cal Mag or a calcium magnesium. That can be good. just so long as when you do that kind of dissolve test that it works. And there's a lot of different types of magnesiums and calcium forms that you need to make sure that you're getting the more bioavailable ones.
Now, twice you have attached D to K. Why?
Because those are synergistic, and they work together. So when you look at just overall health and bone health, we know that it's crucial for many, many things. I kind of use, like even talking about bone health just for a second, a lot of people think of calcium, right? But we realize that calcium, that may be one of the major macro, or the major nutrient in bones, but that's kind of like saying all you need to build a house is 2x4s. We know that there's nails, there's fasteners, there's screws, there's sheathing, there's all this other stuff. So think of vitamin K as being maybe like the nails, right? And calcium, being the 2x4s, and vitamin D maybe being the insulation. Just kind of play with that analogy.
I'm sure a lot of people are saying, all right, how do I test today my vitamin D levels? That's a blood test, right?
Yeah.
So go to your physician, get a blood test.
3 ways. Yeah, physician is one. You can also go online. There's self-directed labs that you can do. It's slipping off the tip of my tongue, not off the tip of my tongue, but there's ways you can go online. And then there's another one, I believe if you go to, I think it's grassrootshealth.net. And if you do a search, people do a search for grassrootshealth.net or vitamin D, you can get home test kits. It's a little finger prick, and you just kind of put a drop of blood on a little piece of paper, you let it dry, you put your name on it, you put it in an envelope, mail it back, and they'll send you your vitamin D levels. And with that, if you're getting your levels tested, you need to make sure that you stop taking any of those supplements about 2 or 3 days before you have your test.
Okay.
Otherwise, you'll get a false high. So you need to stop any vitamin D 2 or 3 days before you have your test, and then that way you get your true baseline.
All right, again, Dr. Gala is with us. He'll be with us for one more segment. Give us a call, 541-776-5770 if you have any questions about this. When we come back, I want him to repeat the core 4, he says, the core 4. Are you taking the core 4? And do you have any comments? 8 seconds? And
8
probiotics?
seconds. And probiotics? Yeah, yes, good.
Good.
Do 'em.
All right, we'll be right back. Okay, we're back, and the doc's in the house, and we're learning so much today about vitamin D, and delighted to have with us Dr. Thaddeus Gala. He's the founder of the Complete Care Healthcare Centers. By the way, 3 locations in Medford?
Yeah, 3 in Medford and 1 in Eagle Point.
And in Eagle Point. And you can go to completecare.net and check out their facilities and services. And check out his book called The Secret to Defy Disease and Decay. It's actually a book and a cookbook, and there's a picture of it there on the screen. Probably get that online at Amazon, or check it out at his website at completecare.net. We're talking about vitamin D. So many things here. Is there a connection between D and thyroid?
Yes, I would say that there is. Before going too deep into that, thyroid is a pretty complex issue.
Yeah.
And you're right, we are learning here today, and learning can be painful, so hopefully we can make this fun for people.
Yeah.
And that is so let me speak kind of globally about vitamin D and what we call VDR, vitamin D receptors. That we find that vitamin D is linked to about 190 plus different specific chemical processes in your body. So what I would say is rather than kind of putting the pinpoint on the thyroid, I would take a step back from kind of that bird's eye view and say vitamin D is crucial for optimum health. So if you don't have optimum vitamin D levels, then that can directly or indirectly disrupt thyroid health because it can disrupt just about any system in your body. So I guess I would kind of answer that question with kind of a global perspective of it's important that we don't look at one nutrient to one disease factor, because then we kind of get in this mindset of a one-to-one, and we know the human body is much more complex than one specific vitamin or nutrient relating to a specific disease. Now, like the sailor's disease, scurvy, the vitamin C deficiency, right? You limey, like that saying, you limey. Right. That's a very specific one-to-one, but that's an overt deficiency. But we also realize, like for vitamin D, the overt deficiency is rickets and osteomalacia. And some people even say, if you have mid-sternal pain, I mean, if just as a quick test, if you rub your knuckles on your chest, if you have pain or sensitivity, that can be a sign of periosteal pain, might be a sign of vitamin D deficiency. So we know that the overt deficiency of vitamin D is rickets, but the subclinical deficiency, meaning being not in the optimal range. So you have overt deficiencies, which is rickets, right? That kids used to get that in the inner city from lack of vitamin C. That's when vitamin D got actually introduced to milk, which that's a whole nother topic for another show, which we won't get into. So when you're subclinically deficient, the doctors may say, yeah, your labs look normal, but you're saying, gosh, well, I have this thyroid issue, and gosh, I just got maybe a positive test for maybe some scare about maybe some potential cancer cells, or gosh, I just got a heart attack, or these other health issues that crop up that can be contributed to by subclinical deficiencies in vitamin T. So you think there's deficient, and then there's subclinical deficiency, then there's sufficient, and then there's optimal. And in that below optimal, from the sufficient to the insufficient and deficiency, there's a whole range of non-classical things that can show up.
Wow, complicated.
Yeah.
All right, by the way, we're going to keep the phone lines open for a few more minutes here. 541-776-5770 is the number to the studio, 541-776-5770. All right. Hi, Nadine. What's going on with your twitching eye?
Well, I've had a twitching eye for a few years now, and a friend of mine discovered when she stopped taking her vitamin D that her eye twitching stopped. And so I stopped taking my vitamin D, and my eye twitching is still kind of continuing, and I just wondered if it might take a while to get out of my system, or if that's actually what caused it, or what. I was taking 10,000 IUs.
Yeah. So first off, I would say that we know that vitamin D can affect the channels that affect the chemical channels that affect muscle activation. I wouldn't say that that's a classical sign and symptom. I'd say most likely eye twitching is going to be due to, it's been my experience clinically and with patients that it's going to be more related to a stress type issue. So I wouldn't say, if you came in, I wouldn't diagnose and say, yeah, eye twitching is classical symptom of vitamin D toxicity or overuse. So I would say, talking to your physician about other things, looking at stresses in your life, making sure that you have your other supplements in line with your body, what would really be the big thing. And when it comes to, again, when we look at health, I wouldn't necessarily say vitamin D is to eye twitching, because you also have to think of the placebo effect. Now, I'm not saying that this is going on with your friend, but we know that there was a recent study that came out with IBS, irritable bowel syndrome, and they gave patients the medication, which it was on the market for about 5 years, and then it was pulled off the market. So a very dangerous medication. The FDA said this is causing too many problems. We need to pull off the market. They had about a 59% reduction of IBS symptoms by taking this pill. Well, a couple of years later, this other team went back and said, we're going to do a placebo only, meaning that they told people, this is a placebo for your IBS. I want you to take this, and then let's see how you do. They told people, there wasn't any secret to it. They told people it was a placebo, and they had a 58% reduction in their IBS. So by telling someone it was a placebo, they had the same power as giving them the medication. So could have happened with your friend just by thinking it, or it could have actually been a true mechanism, but we can't discount the power of placebo in medicine. But I would say look at stress, and then talking to your physician, and then normalizing your other supplements in your life.
There you go.
All right, thank you.
Thanks,
You're welcome.
Nadine. All right, let's go to Jean. Hi, Jean.
Hello.
Oh, arthritis.
Yeah, I've just been diagnosed with rheumatoid arthritis. I've been taking prednisone for the last month every day, like five pills, and then down to four, and so on. Right. When I'm through with all this, then it'll be down to one. Then the doctor's thinking of giving me something, stronger pills.
So what's your question?
Should I be taking anything unusual, big amounts of anything else?
So we know
for the pain, or to get myself a bit more healthy?
Okay. Yeah, great question. So with RA, a couple things. Number one is we know that corticosteroids can disrupt vitamin D balance in the body. So if you're taking those kind of medications, that can disrupt it, number one. We also know that the higher you get away from the equator, meaning, and typically that corresponds with lower vitamin D levels, we have increased rates of rheumatoid arthritis. I know, I think of one gal I had, she's actually a school teacher. She had rheumatoid arthritis for I think 19, 20 years. She was taking massive doses of Enbrel. I think we added it up. She had spent over $960,000 on this medication for her RA. And after we worked with her for 1 month, normalized some other things in her body, got her inflammation down, she was off it completely. And she's been off, and now she's been in remission for, I think, the last 6 months now. So I know our RA can respond really well to reducing subclinical inflammation, getting vitamin D levels in the appropriate range, and a handful of other things. So yeah, people with RA need to be specifically cognizant of their vitamin D levels, and that goes for any autoimmune type issue for that matter.
There you go. All right, thank you, Gene. That's powerful, because so often you're afraid to do that.
Yeah.
The doctor's prescribing this, you're afraid to come down and try something else.
Well, but here's the problem though, Perry, just the mindset of, and I'm not saying that RA isn't a complex issue, but there's some research to show that up to 75% of doctor's visits end in a prescription being written. So we have this mindset of when we go into the doctor's office, we expect to leave with something, and it's almost like if we leave with knowledge or education, we almost feel like we didn't get what we paid for.
You got cheated. All right, the core four. What are they again?
Yeah, so the core four, these are the ones that most people are deficient in. Okay. So this is where I typically suggest starting. Some people may already be doing this, so that's the starting point. For me, I take handfuls of supplements every day, because I know the benefits, but at a minimum, I would say starting with an EPA DHA, which is which is a fish oil. So again, versus like a flaxseed oil. So I suggest fish oil. I would suggest a vitamin D combined with a vitamin K, a multivitamin. If you're female and you're still menstruating, then I'd say probably do it with iron. If you're either male or if you're female and you're not and you're postmenopausal, then I would say without iron. And then the other one would be a magnesium. Those would be the core four, and I'd say starting with those is going to give you a good baseline. Now, you may not feel anything, and that's the difference here, is supplements are to help supplement a healthy lifestyle long term. So people that take all these supplements say, well, I don't feel any better. Well, that's good, because you don't want to feel a lump, or you don't want to feel a cancer growing, or you don't want to feel a heart attack. So a lot of times, we want to do something and feel it, and I get that. But we have to look at the research and say, what's the long-term health benefits of this?
I'd ask the question. I only gave you 8 seconds. Probiotics, they're back on, and you see a lot of other foods that announce or pronounce probiotics in them. What's your thoughts?
Yeah, I think probiotics are great, especially if someone is doing a course of antibiotics. They have to, want to follow it up with probiotics. But it's like a lot of they're saying that health starts in the gut, and so much of it defines that if we don't have a healthy digestive tract, or if our gut isn't healthy or GI tract isn't healthy, how can you absorb your nutrients right? How can you absorb your vitamins, minerals, your antioxidants, your macronutrients? So yeah, having your probiotics healthy means you're the cradle of life in your intestines. That is the main source of your health, or the first line of defense rather. May not be functioning appropriately. And if that isn't functioning properly, you can get things like leaky gut, ulcerative colitis, Crohn's, IBS, diverticulitis, other issues that then impair the absorption of these other key nutrients, leading you susceptible to other health issues.
Wow. All right, let me just say to our viewers and listeners again, Dr. Gala's website is completecare.net. 3 clinics in the Medford area, 1 in the Eagle Point area. And you can check out his book. It's called The Secret to Defy Disease and Decay, and it comes with a complimentary cookbook. There it is. Is that a chocolate cake you have on the phone?
I know. You wouldn't think it, but believe it or not, being healthy can be fun and easy. It actually can.
Well, there you go. Check it out. And vitamin D is the big subject today. So I would say what I'm hearing you say is get tested for it.
Yep, absolutely.
See what your levels are. And so often a physician would prescribe the minimum amount, and you're saying, wait a minute, you may want to look at that.
Yeah, so the RDA, or the government recommends about 600 IUs a day. If you go out in the sun, so here's the key, if you go out in the sun in about 20 to 30 minutes of full arms, chest, legs, your body will make about 20,000 international units. Now, I don't know about you, but I like to think that the way our body was designed, it was designed very intentionally, and that's the way that we're designed. So that's where we naturally resonate, is about 20,000 units a day. I'm not saying that we should all go do 20,000 units, but we know it's a far cry from what the government recommends as 600.
All right. Let me squeeze in one more before we run out of time. Paula, quickly, go ahead. What's your question?
Yes. I've recently developed folliculitis, and I'm listening to you talk, and I'm thinking I don't do any basic vitamins or vitamin D. I don't know if that would affect a skin infection like that. or if, and what tests do I need to go to, and what do I need to ask for when I go to a lab to get the screening specifically for vitamin D and other vitamins in my body?
Yeah, great question. So most traditional clinics and physicians aren't going to be testing for vitamins and minerals. They normally look at the blood levels and they say, oh, your calcium blood levels are okay. But what we find is that those blood levels are so important that your body will do it at the expense of your bones. And you think of how common osteoporosis is. So your doctor may say your calcium levels are good, but they realize that it's robbing it from the bones to make the blood levels good. So you need to get what I term a functional medicine provider. I think that is probably the biggest thing, is finding a provider that's geared towards working on the root cause rather than just treating symptoms. So in terms of the vitamin D test, you can go in and just say, hey doc, I want a vitamin D test, and they'll do that. Some of those other things that I was mentioning, they may not do it at the lab, or they may not understand it if they're not a functional medicine provider. There are tests for it, though, out there.
All right, got to go. Thank you, Paula. Let me just say to our viewers and listeners, we can have him all day, but he's got to go. He's got patients to go see. Check out his book called The Secret to Defy Disease and Decay. There's a picture of it there on the screen, either at Amazon or go to his website, and that's completecare.net, and you'll find out the locations to the various clinics. Thank you, doctor.
You're welcome.
Good to
Thank
see you.
you.
Thank you.
This is great, like always.
All right, take your vitamin D and drink lots of water. We'll be right back. All right.